Welcome to the Northeast Kingdom Voice. I'm your host, Scott Wheeler. Today, our topic is Northeast Kingdom Human Services, and we have two of the employees, including the executive director here, to talk about their agency. Welcome to the show.
Thank you very much, Scott. It's a pleasure to be here.
I'm really glad the two of you were able to come on, because I think in these times, I think we need you folks more than ever. I'll let you introduce yourself.
Okay, my name is, well, first of all, thank you very much for having us over, and we are looking forward to having this conversation to talk a little bit more and to amplify the issue of mental health, substance use, and intellectual disabilities, and how our organization is in a best position to not only meet but also to exceed those services. My name is Tomasz Jankowski. I have been the president and CEO of Northeast Kingdom Human Services for the past 10 months. I'm a doctor of rehabilitation and physical therapy. I have been in the healthcare business for almost 30 years now. My first experience with Vermont dates back to 1993, when I was first hired as an administrative fellow by, at that time, the president and CEO of MCHV, Jim Taylor. It seems as though after having been to many places in the meantime, I have made a full circle by coming back to Vermont, and I'm very pleased to be back.
Hi, thank you for having us as well. My name is Lila Bennett. I am a Vermonter, and I am the Director of Marketing, Development, and Communications at Northeast Kingdom Human Services. And it's a relatively new role. I have been working at NKHS since January, and it's very exciting because it's a way to outwardly speak to the community about what we do and the services we provide and the importance of it, to work on destigmatizing mental health and mental illness. So I'm excited.
We've communicated quite a bit for the last, since your arrival, just to make this show happen. And I've, as I was saying before the show, you've been doing a phenomenal job at helping get the good word of your agency out there, because
Thank you.
I've been affiliated one way or the other with your organization, whether it was back when I was in college, sleeping over or working overnight shift. I have friends there who work there, and I don't recall there being this kind of positive outreach that you're doing. And so, and I imagine that must be in part because of you as well.
Well, I believe in community education, and I believe that making sure that Northeast Kingdom Human Services is not a secret in the community. This organization is here to provide mental health care, substance use, and IDDS services, but it is also here to save lives, and we do the entire spectrum of services, and we are very proud of it. And I would also say is that, yes, it took us a little bit of time to find the right person for the right job. And I'm very pleased that we were able to find Lila. And I'm very happy to hear your assessment of the work that she is doing and our organization is doing in making sure that the community knows about our existence and understands what we do and how we make an impact, or what impact we make on the lives of many.
I think, I know we spoke beforehand a bit, but I think dialogue is a great way for any topic to destigmatize.
Definitely.
Just and to put, I know it takes special people to actually talk publicly about their mental health issues. But as we were saying, I've had people on here who are recovering and sometimes rebounding heroin users or opiate addicts, and they are some of the best voices of our opiate epidemic, and they have so much to offer, and I think, and it destigmatizes it, and it's like, you know, any other parts of mental health, and that's how come I really think you've really moved in the right direction.
Thank you.
So tell me, why Vermont's Northeast Kingdom? Why did you decide to call this home?
So after having left Vermont, I lived in a few places. The most recent place was the state of Ohio, where I was associated with very large organizations, medical centers, the Ohio State University, Wexner Medical Center, and also one of the Goliaths in the healthcare field, the Mercy Health. Mental health, while I was the director of the Neuroscience Institute for Mercy Health, one of my divisions that I have managed was behavioral health, but it was on the acute side of mental health care delivery. When this opportunity came about, it intrigued me, to say the least. And especially that it was probably one of those fields in healthcare over the past 30 years that I have not spent a lot of time working in. And I thought that this is going to greatly complement my my healthcare experience, but also it's the field where I can bring the experience of the past and perhaps bring some ideas, bring some new vision, and work with my team and the community of making our organization better, bigger, more effective. And I think that because of my belief in the diversity of opinion and in heterogeneous way of thinking rather than a homogeneous way of thinking, I thought that I can make an impact not only on this organization, but also in working with my team on the community at large.
Right. Have you been pretty pleased about your time here?
As I said earlier, I've been here for about 10 months, and it has been a fabulous period of time. I've been here in the summer, I've been here in the winter,
Right.
and now I'm heading into the mud season. I have liked all of the seasons. Obviously, it's one of the most gorgeous places that I have ever lived in, Northeast Kingdom, that is. I'm surrounded by an incredible team of employees, whether it's my direct management team or the employees in general. I think we have a lot of talent. I know that we have gone through periods of time in the past that were challenging, and we are getting out of those challenges step by step. I am very pleased to be a part of that reorganization, that change of thinking, and perhaps a different way of thinking about mental health care delivery. Yes, this has been a fabulous experience. I'm still transitioning into establishing myself in a community. I have been surrounded by very well-meaning people. So yes, the last 10 months have been very good.
Right. And we were talking before the show. I'm going to try to connect you to one of the people who was in your shoes, but he was also the founder of one of the founders of your organization, George Coulter, who is now in his 80s, and he's a very esteemed person who his work in mental health in the Northeast Kingdom goes back to the 1960s, and I'm sure he'll be able to provide you with a very long history of the evolution of mental health in this area, because before Northeast Kingdom, well, Human Services now, he founded it as Northeast Kingdom Mental Health. Before your organization was founded, there was very little in the way of mental health care. A lot of times the mental health care involved sending people to the Vermont State Hospital for severe cases.
Well, I look very much forward to meeting this gentleman and learning from his perspective, and certainly learning about the history of our organization and the mental health industry, mental health industry in the state.
Right. So from being the marketing person, you're kind of in a sense, you're kind of the, maybe not the public face, but you're the behind-the-scenes face of Northeast Kingdom Human Services. How has your time been with them?
So far, it's been exciting and inspiring. I feel very fortunate to work with the team that I'm working with. I think that Tomas has a very pointed vision that's also supportive and allows the team to bring their own creative energy to our work. So it allows me to be able to learn about our organization, absorb what the community needs to hear, and then bring all of that to the table. So for me, it's just been really exciting, and I feel like I can be effective in my work because of the support that I get.
And to be realistic too is you're from totally different walks of life. It sounds like, because you're a farm woman. Yes. And you're from the I guess academic world, and so it just seems like that makes some people would say that's a recipe for disaster, but for you it seems to be really working well, because it seems to be that you're allowing her to really use her innate talents of Vermonters to really tap into them.
Because I will probably never understand the nuances of the Northeast Kingdom's culture.
Right.
But I think I'm smart enough, I suppose,
right.
to know when to step out of the way and let the people who know more about it to really take charge and help me lead this organization forward. I would also say that I'm very fortunate to be surrounded by a very supportive board of directors,
right.
Yes.
Very, very committed group of people, and I'm very proud to be working for them and with them. I'm also very proud of my management team,
right.
who is open to new ideas,
Mm-hmm.
who is looking forward to evaluating the ways in which we have served the community, and look at other opportunities in which we can be more effective, more proactive.
Right.
And so when I say that there hasn't been a day over the past 10 months that I woke up in the morning and didn't want to come to work, that day has not come. Every day I get up in the morning and I look forward to coming to work, because to me, work is fun.
Mm-hmm.
That's where my kind of second home is, and I'm enjoying it a lot.
I know the feeling. I get out of work. My whole job is talking to people. As in, I interview my work in my real world. I just go around the Northeast Kingdom. I focus most of mine on people, 80s, 90s, and older. But so I know the feeling about loving your work. But now we are in a time where mental health issues really are coming
Yes.
into the spotlight, whether it be the opiate issues, and then one issue is the lack of beds as well for people with serious issues. And like I've been reading, and I'm familiar with the issues of some of severe clients being placed in hospitals and and the challenges that brings as well. You must have a close working relationship for the different agencies, don't you?
We do. This problem is a problem well known in the entire state of Vermont.
Right.
Well, I would even say more. This problem really exists in every state in the U.S.
Mm-hmm.
Of course, our microcosm is the state of Vermont. And our organization has a very close relationship with our two local hospitals, the North Country Hospital,
Right.
as well as the NVRH in
Right.
St. Johnsbury. We want to provide a seamless delivery of care, whereby our professionals can be present in the hospitals to address the issues of emergency care at the level of psychiatric help. We are in conversations with both hospitals, with both CEOs, who are also very progressive, very forward-thinking individuals, to find the best ways in which we can provide that comprehensive and a well-connected care.
Right.
Not only a care that is going to limit itself to psychiatric services, but also physical services in general. Having come from a physical and a medical health background, I see a lot of connectivity between those two.
Mm-hmm.
You know, people frequently afflicted by medical conditions are also afflicted by mental health conditions and vice versa.
Mm-hmm.
And it is my vision for this organization that we do become a whole health service provider in collaboration and conjunction with our partners, whether it's the hospitals or whether it's any other community-based organizations, to really become the agent of change,
Right.
and the one that looks at the wholeness and at the entire well-being of an individual, whether it's an infant, a child, an adult, or an elderly. We are making some internal changes, organizational changes, that are going to allow us to decompartmentalize ourselves, ourselves. In other words, moving from an age-based provision of care to a longitudinal and across the life spectrum provision of care.
Right.
And change is not always easy, but we are making it happen, and I think we are seeing good signs.
Right. So tell me a little bit about One Care Vermont.
One Care Vermont is an organization based in Colchester, Vermont, and I have the privilege of serving as one of the directors of the board of One Care Vermont. It's an organization that has been formed
Right.
under so-called all-payer model
Mm-hmm.
that brings together major payers such as Medicare, Medicaid, and private insurance companies to make a meaningful change in the way health services are provided in the state, of which that major payers are some of the biggest factors. This organization was formed initially by UVM Medical Center and Dartmouth Hitchcock Medical Center. It has a 20-member board of directors that is being represented by different individuals from community-based organizations, from medical centers, from hospitals, etc. And it is about bringing change in a way that the services, health care services, are delivered in Vermont in a way that is managed from the financial standpoint as well.
Yeah, because the whole insurance thing is that's so complex, because in a previous chapter of my life, I actually served in the Vermont House on the healthcare committee.
Yeah.
So everything, to people sitting back when they hear about all this, issues of health care, of insurance, it's, it seems so simple, but when you get down into the weeds of it, there's so much going on there, and I'm sure you would probably agree with that.
Well, the healthcare landscape in Vermont, as anywhere else, is quite complex.
Right.
And with the example of One Care, the state of Vermont is at the front line of bringing meaningful changes to the way in which healthcare is delivered
Right.
in the state and hopefully in the future in the country. And I'm very pleased and very fortunate to be a part of such environment. And I believe also, as one of the directors of the board of One Care Vermont, is that we are going to be successful, and we indeed are going to make the changes that we expect to be made, and become the state in the country that has the best model of providing healthcare at the most reasonable cost.
I think the one thing about the Northeast Kingdom, because there's pros and cons about life in the Northeast Kingdom, but I think for the most part, is people still they help one another. Even what I tell people is we like to play together. We like to work together. Occasionally, we like to fight together. But when times get tough, I think the people of the Northeast Kingdom are a pretty tight group. So I think you're going to find that there's a lot of members of the community they're going to support what you're doing.
We are, either through Lila's work or my work
Right.
or any of my leadership team, we want to be as present in the community as possible, because I think we can tell our story through education. And this is what we do each and every day. And like I said earlier, I'm very pleased to hear your assessment of the work that we are doing, because this is the testimony of a community representative of how effectively we try to communicate with our communities. And our service area is very large. We
Yes.
cover three large counties. We cover about 22% of the state area-wise. And last year, we have provided services to almost 4,000 individuals. And this is a significant number. And interestingly enough, the needs are even greater than the number that I just mentioned to you. We are trying to find innovative ways through which we can continue growing and providing services to those that today we cannot reach. Our organization, and so maybe for the people listening and watching us, our organization is a private community-based organization that is tax exempt. It's a 501c3 organization. We are not a state agency. And most of our revenue that we earn for providing the services come from Medicaid.
Now, do you also it's widely known about the physical health care, as in like the hospitals. They're even our local hospital is struggling financially. It's just I know it's a Vermont-wide issue. The hospitals are really financially strapped. How is Northeast Kingdom Mental Health doing on that front?
Well, under my leadership, we are evaluating and scrutinizing our operations to evaluate whether or not the way in which we provide the services are the best ways in providing those services, because we are only as good or as needed in the community as we are able to provide those services. So we are constantly looking at ways in which we operate, at our organizational structure, looking at our administrative costs, eliminating as many of them as possible, and reinvesting those funds in our clinical employees, because this is what we are here for. And working with my team, we have been able to accomplish a lot of it. There is still some work ahead of us, but this is one of my visionary pillars, and I have very easy five pillars that I have been communicating for the past number of months. One of them is the operational excellence. Number 2, it's the amazing patient experience. Number 3 is creating the future. Number 4 is employee engagement. And last but not least is the community benefit. So my vision for this organization is embedded in those 5 pillars that really address the wholeness of what I would like to accomplish by leading this organization and projecting the benefit to our community.
Right. Back to one issue that I mentioned is I've had on recovering opiate addicts, and throughout the years they've said it's gotten better being able to seek seek care. Now, do you deal with that topic at your agency?
Oh, absolutely. Are you referring to access
Yes.
to care? Absolutely, yes. As I mentioned earlier, we are challenged by recruiting the right clinicians, but that's not an issue that is unique to Northeast Kingdom Human Services. That challenge exists everywhere else in the state. But we are changing our approaches to recruitment. We are kind of stepping outside of the box in our thinking about how can we recruit the best skill and the best clinical personnel to join our organization. So we have created incentives, and we have created different programs. Our outreach to recruit new employees has widened dramatically. We are present at colleges, we are present at fairs, we are utilizing recruitment methods that perhaps we have not utilized in the past. So I'm very pleased to see the results of our work, and it is my vision that Northeast Kingdom Human Services become the provider of choice. That the only reason people will not be working for Northeast Kingdom is if we don't have openings. Obviously, we have a little bit of a road ahead of us, but I definitely would like us to be one of the most competitive organizations, both for the quality of work and life balance, but also for the compensation.
I will say that and I'm sure you've already thought about this, is we get, this area is able to find, in the medical world too, they struggle with the exact same issue of attracting people to the Northeast Kingdom, because it's not for everybody. You have to be the right mindset to want to live here, but the two ski mountains happens to be a large draw. I know I have a friend who's a oncologist who he came from, I believe it was Yale, and he lives and works and practices in the Northeast Kingdom. His deciding factor was Jay Peak, provides outstanding skiing, and to some people, like, well, that's not enough of a reason to live somewhere. Well, if you really love skiing and boarding, Jay Peak and Burke, they're a huge draw.
I would say, too, that part of the reason that it's exciting that we are joining boards like OneCare is because it's allowing Northeast Kingdom Human Services to be more progressive in all ways, like looking at our funding, looking at our recruitment, looking at our hiring, looking at how we're compensating staff. And as we work together with our community to show that not only do we provide amazing services, but we take care of our employees and we work together, it kind of creates a whole package that does make it so that people want to come and work with us. And as we grow and destigmatize mental health, it all kind of hopefully is coming together, that there will be more people that are coming to our agency for care, and then we can continue to hire and grow.
And I know we're running out of time, and care does not have to mean these, big issues that you're seeing in the news. Some of it is you just
need a little help sometimes.
Need a little help, and I think sometimes those people are the ones who maybe don't feel like, well, that isn't really for me. That's for the substance users. That's for this. No, you provide care for everybody in mental health.
And I would say a difference, sometimes people confuse mental illness with mental health.
Right.
And they're actually different. And we all need to take care of our mental health. And our tagline at Northeast Kingdom Human Services is, we are all about being human. And that's really what it is. We are all human, and we all need care and support sometimes. And our organization offers that to everyone.
Now, if somebody listening feels that they need what your agency has to offer, if they're going through something, how can they contact your agency?
They can call us at 802-334-6744,
Right.
and they will reach someone.
Right.
They can also go onto our website
Right.
to learn about our services, which is www.nkhs.org.
Right. Okay, we're just about out of time, but I'll give each one of you a couple minutes here. Who wants to go first?
Well, first of all, thank you very much for inviting us to this conversation, and thank you for giving us the stage and an opportunity to speak to our community about who we are and what we do, and perhaps give you a little bit of an insight to the two individuals that are sitting with you today. We are incredibly proud to be able to provide the services and be the asset to the community for almost 60 years. As a matter of fact, in 2020 we will be celebrating our 60th anniversary. Each and every employee of our organization is incredibly committed to the work that they do and the mission that this organization serves. The board of directors is an incredibly supportive group of individuals who want this organization to continue growing and continue not only meeting but exceeding the expectations of the community. I'm very honored and humbled to have served as the Chief Executive Officer for the past few months, and I plan to be here for much, much longer. I encourage my team to think outside the box and to come up with ideas, because if we don't make changes, if we don't change the ways in which we do things, in which we operate, we are definitely not going to move forward. I envision the future of this organization to encompass healthcare, and to accomplish that, I want to make sure that we have the best partnership opportunities with our either community-based organizations or hospitals, and that we work together in utilizing our own expertise in weaving those into the fabric of the community providers of any kind. And again, thank you very much for having us over. And there's more to come in terms of the news in the near future about the changes that we are making in Northeast Kingdom.
You're always welcome to come back on too.
And I will be delighted to come and join you again, maybe even more than once, to share the good story about our organization.
Okay.
Thank you. Yes, I want to echo that and say thank you for having us on. It was exciting to have the opportunity, and for me, I am excited to be a part of this work and the progress toward helping our community and helping people understand the importance of mental health for all of us. I think that it's some of the most important work that we can be doing right now as a society is destigmatizing mental health and educating our communities and working together to make progress toward general well-being. So for me, this is a wonderful opportunity to get to speak out about the good work that we're doing at Northeast Kingdom.
I also wanted to recognize the many legislators who serve the 3 counties of the Northeast Kingdom that our organization works with. They are incredibly committed and supportive of the work that we do, and they are very committed and supportive of the communities that we serve. And I just wanted to make sure that among all the others that I have recognized this morning, that I also recognized our legislators, our senators, and our representatives who tirelessly support the communities that we serve.
Okay, well, thank you for both coming on. But before we get done, I wanted to give you both copies of one of my latest books, Newport Centennial: Voices from a Lakeside Community. And the reason I wanted to give it to you because, especially with you being a relatively newcomer, it provides a glimpse into the people of the region. Because when I write history, I don't write it existential. I talk to the I talk to the people, the ordinary people, and sometimes people who are totally written out of history. And I thought this would be a great way for
Thank you.
for you to
Thank you very much.
Thank you
to,
very
to
much.
really understand what makes this area that you are now living in tick. And so
Thank you. Can I have it dedicated?
sure, I will do that.
Okay, thank you very much.
All right, and thank you both for coming on.
Thank you very much.
Thank you so much, Scott.
Thank you. And thank you to the viewers for tuning in to another segment of the Northeast Kingdom Voice.